Hello and welcome to the BSG podcast on occupational health. My name's Chris Chapman and I'm the Head of Technical Support here in the Bristol office. Agenda for today, first thing a little bit about BSG, then we'll talk about what occupational health is and the differences between occupational health and health surveillance, what you need to consider, how we can help you, and a summary of the key action points to be taken. And there's an opportunity to email questions in once you've listened to this podcast. So BSG, who are we? We were established in 1965. We operate throughout mainland UK. We're a not-for-profit organisation and we're owned by our membership for the benefit of our membership, and we're recognised by the HSE. We're the largest construction safety group within the UK with over 800 members located throughout mainland UK. We carry out over 18,000 site inspections every year. We look after 23,000 operatives, 3,000 workplaces apart from construction sites, and over 10,000 people attend our training courses every year. Our accreditations and memberships, we were investors in people. We carry the accreditation for ISO 9001, quality assurance, 14,001, which is the environmental accreditation, and OSAS 18,001, the occupational health and safety. We're a member of the Chartered Building Consultancy, we're a member of ROSPA, and we're accredited for carrying out the Construction Skills Construction Industry Training Board courses, including the Site Managers Safety Training Scheme and the Site Supervisors Safety Training Scheme. We're also accredited for carrying out the NEBOSH National Construction Certificate. Our membership coverage, as you can see, covers us from right up in Scotland down to the tip of Cornwall, and the red dots are our regional training centres. So that's us, but what we're here to talk about today is occupational health. What is occupational health? It's a good question and people do get confused by the term. Well, it's a speciality that considers very specifically the effects of work on our health, and it considers the individual's health, ability and fitness to perform a particular job, and the law places a duty on employers to ensure that the health and safety of their employees and others who may be affected by their work activities. And this duty includes ensuring that employees and others are physically and mentally capable of undertaking the tasks they're required to carry out. And the HSE are focusing on occupational health during their site blitzes and have placed a greater importance on health as well as safety. The HSE commissioned a study into the occupational health standards within the construction industry, and this is a small précis of that study, and the main findings were that the construction sector is a complex environment, as both the workplace and the workforce are non-static. Well, we all knew that, but nonetheless there are common requirements of health and safety legislation and objectives for occupational disease reduction, and the core elements of occupational health provision were identified and recommendations were made for health monitoring and surveillance of the main occupational conditions affecting the construction sector. And the recommendations that came out of it were minimum standards for occupational health providers should be adopted. Construction employers should have policies which relate not only to safety but occupational health strategy and provision. And appropriate procedures should be adopted for the pre-placement confirmation of employee fitness. Minimum standards are advised for health monitoring and surveillance for hand-on vibration syndrome, noise-induced hearing loss, dermatitis, respiratory diseases, musculoskeletal problems and stress. Minimum standards for safety critical work are advised, and consideration should be given to the legal and ethical issues identified in establishing a national database for the construction sector. So the legislation that covers all this, there's quite a bit of it, but we have to remember that none of these regulations clash or conflict with one another. They're all there to give us more information on the requirements of the first thing, the Health and Safety at Work Act 1974. The Health and Safety at Work Act 1974 places a duty on employers to provide a safe and healthy place of work for every employer. So how are we going to achieve that? Well, more detail of that is given in the Management of Health at Work regulations, where they talk about carrying out risk assessments. So we look at what the problems and hazards are in the tasks we ask people to do. We've also got the Construction Design and Management regulations, a particular set of regulations for a particular industry. They only apply to the construction industry, whereas all the other legislation we're looking at there complies to everyone at work. Control of asbestos regulations, control of lead at work regulations, control of noise at work regulations, control of vibration at work regulations, controlled substances hazardous to health regulations, COSH, and the manual handling regulations. And this is a set of slides that were issued by the HSE to visually bring home the point of the cost of occupational ill health in our industry. The first slide, every week, from construction-related ill health, 100 of us will die. So why is occupational health important? Well, workplace ill health kills and ruins lives in the construction industry, and statistics indicate that a construction worker is at least 100 times more likely to die from a disease caused or made worse by their work as they are from a fatal accident. And managing workplace health helps employers to retain experienced and skilled workers, and it helps employees to maintain productive employment. Workplace ill health is preventable, totally preventable. It is possible and practical to carry out construction work without causing ill health, and we're required to by law. A risk to health can be managed by modifying the process to eliminate the risk, controlling and minimising exposures, and taking precautions to prevent adverse effects. Everyone involved in construction has a responsibility in managing risk to health, and all parties must take ownership of their part of the process. Planning and working collaboratively will reduce the risks throughout the supply chain and at all stages of the process. Workers and their representatives must be consulted regarding the provision of occupational health services and material occupational health issues. Managing health risks is no different to managing safety risks. Assessing hazards and using a hierarchy of control measures are equally appropriate when applied to health risks. And checking a worker's health is no substitute for managing and controlling the health risks. Monitoring should not be given priority over managing, or it shouldn't be confused with it. Helping workers tackle other lifestyle risks to their health is not a suitable substitute for managing workplace health risks. Some more statistics here. 54% of construction workers are no longer physically capable of doing their job at the age of 60. Workers in the construction sector are 4 times more likely to suffer from vibration white finger than workers in any other industry. And 3,500 cases of musculoskeletal disease are reported each year. And 98% of all health and safety related deaths are caused by ill health rather than accidents. 56% of all male occupational cancers are caused by working in the construction industry. There were 6,751 workers under medical surveillance for lead exposure in 2013-14. And over 500 construction workers are believed to die from exposure to silica dust every year. And these devastating statistics, all of it completely and utterly avoidable. Skin, 2014, solar radiation, coal tars and pitches were responsible for 1,300 cancer registrations, mostly causing skin cancer other than melanoma. Stress, the top 5 most stressful aspects of work in the construction industry include having too much to do in the time available, excessive travelling and commuting, being responsible for the safety of others at work, working long hours, or having a dangerous job. Only 7% of employers currently employ an occupational health advisor or a nurse. 27% of employers carry out a baseline health check on new apprentices joining their companies. And 57% of employers will welcome additional support and advice on occupational health. And around 70,000 working days are lost each year due to ill health. And 1/3 of construction workers have occupational health issues. Again, some of these statistics are quite frightening. So that's occupational health and how it affects us, but what's health surveillance and what's the difference? Well, health surveillance is a system of ongoing health checks, and these health checks may be required by law for employees who are exposed to noise or vibration, ionizing radiation, solvents, fumes, dusts, biological agents, and other substances hazardous to health, or work in pressurized environments. This is a recent case study, and it highlights the importance of managing and monitoring the health risks to workers. The Thanet District Council have been fined after one of its employees developed hand-arm vibration syndrome. Following the diagnosis, a further 15 cases of ill health relating to vibration exposure were discovered. When it investigated the first incident, the health and safety executive found that the worker had spent up to 6 hours a day operating electrically powered equipment such as mowers and hedge cutters. He was under no health surveillance and was unaware of how to report his symptoms. He was diagnosed after he visited his GP. Canterbury Crown Court was told that the council started to implement appropriate health surveillance after the HSE had served it with an improvement notice regarding this case. During this time, 15 more cases of hand-arm vibration syndrome were identified and reported to the executive. The HSE said the council had taken no steps to eliminate or control its workers' exposure to hand-arm vibration syndrome, and it had failed to train them on the risks of vibration exposure caused by power tools and how to control it. The council pleaded guilty to breaches of Regulations 6 and 7 of the Control of Vibration at Work regulations. The council was fined £250,000 and was ordered to pay £18,325 costs. Hand-on vibration is completely preventable. Once the damage is done, it is permanent, said Inspector Mike Walters. And that's true. In this case, they'd taken no measures at all. Guy's hand started to play up, went to the doctor, was diagnosed with hand-arm vibration, went back to his employer, the council, and informed them that he'd been diagnosed with it, and they quite rightly reported it to the HSE. It is a reportable industrial disease, which brought the spotlight on them. They carried out health surveillance on the rest of their employees and found 15 more cases. You can see by the size of the fine how seriously the HSE took it. Regulation 6 of the Vibration Control at Work regulations, which is what they were prosecuted under, says the employer shall ensure that risk from exposure of his employees to vibration is either eliminated at source or where that isn't reasonably practicable, reduced to as low a level as is reasonably practicable. And where it's not reasonably practicable to eliminate risks at source pursuant to paragraph 1, and that an exposure of action value is likely to be reached or exceeded, the employer shall reduce exposure to as low a level as is reasonably practicable by establishing and implementing a program of organisational and technical measures which is appropriate to the activity. So what they're basically saying there is that if you've got a machine that produces far too much vibration, cut down the time it's being used. It's exposure to magnitude. And 7, which was the other paragraph that they pleaded guilty to, was that if the risk assessment indicates that the risk to health of his employees who are or liable to be exposed to vibration, or employees are likely to be exposed to vibration at or above an exposure action value, the employer shall ensure that such employees are placed under suitable health surveillance. So, to say they failed to protect them from the vibration and then failed to health surveil them. And 7, which was the other paragraph that they pleaded guilty to, was that if the risk assessment indicates that the risk to health of his employees who are or liable to be exposed to vibration, or employees are likely to be exposed to vibration at or above an exposure action value, the employer shall ensure that such employees are placed under suitable health surveillance. So, to say they failed to protect them from the vibration and then failed to health surveil them. So, when considering occupational health and the effect on your workers' health from what you're asking them to do, these are the things you need to consider. Key considerations for all duty holders. Clients under CDM now have certain duties to ensure suitable arrangements are in place. Designers need to identify and eliminate health hazards under Regulation 9 of CDM, and principal designers have a role to manage health risks in the pre-construction phase under the CDM regulations. And contractors must manage any occupational health risks that their workers may be exposed to, and obviously workers need to look after their own health and cooperate with others such as their employers to help them achieve that. The Management of Health and Safety at Work regulations state that employers who appoint doctors, nurses or other health professionals to advise them on the effects of work on employee health or to carry out certain procedures, for example health surveillance, should first check that the providers can offer evidence of sufficient level of expertise or training in occupational health. And this is reinforced by the Health Surveillance at Work Guidance, HSG 61, which states that it is the duty of the employer to provide health surveillance for those employees considered at risk, and that is essential that the people who carry out health surveillance are competent to do so. Managing health risks follows the same principles as managing safety risks. Risk assessments should be used to identify any need for health surveillance, and health surveillance should not be used as a substitute for undertaking risk assessments or employing effective controls. Health surveillance can sometimes be used to help identify where more needs to be done to control risks, and where early signs of work-related ill health are detected, employees should take action to prevent further harm and protect employees. and we should avoid blanket coverage for all employees because they're all faced with different levels of risk. So they're the things that we have to consider, and then we look at how BSG can help. In our suite of documents that's available to all members on our website, there's the BSG Occupational Health Procedure Template, which will take you through the process, but again, you have to identify where your company lies, whether you have safety critical workers and what sort of work you have to carry out. This year, the Building Safety Group will offer an occupational health consultancy service, which has already started to be rolled out. This service will include a survey to identify the risks to the health of your workforce, the development of a procedure to monitor and control workplace exposure limits of plant, tools and substances, the development of a training program for operatives to make them aware of the risks to their health and how to avoid them, and the creation of registers for plant, tools, materials and substances recording their workplace exposure limit, and procedures for a baseline assessment of the current workforce, procedures for the pre-placement confirmation of employee fitness, procedures for safety critical worker assessments, creation of a database for all operatives, in-house training of your occupational health administrator, and assistance in appointing an occupational health provider. And for any more information, please do contact me on the information that's shown on the screen. My phone number and email are there, and I'd welcome any inquiries and questions that you may have on this podcast. So, in summary, what are the key action points you have to take from this? Basically, same as we've always done for safety, assess the level of risk to employees, reduce as far as is reasonably practicable exposure of all risks to health, manage the risks and not lifestyles, carry out initial assessments. You cannot manage what you haven't measured. We need to know where we're starting and draw a line in the sand, and keep records. Keep good, substantial records, and we'll probably need to be talking about the Data Protection Act with some of this information. So hopefully that's given you an insight into what's required by law for your company, and as I say, if you've got any questions at all, please do contact me, and I'd look forward to hearing from you. Thank you very much for listening, and I hope it's been useful.